Hi, this is Bill Gundelfinger. I'm also known as Mr. Medicare. And as we're approaching the annual open enrollment period for Medicare Part D and Medicare Advantage, I want to keep you informed on some coming changes. In 2021, the Inflation Reduction Act was signed into law. This law makes significant changes to Medicare Part D, the prescription drug coverage that most of us have. Um, and these changes will take place over the course of several years. They all started back in 2022. We're now in 2024 and approaching 2025. So as we approach 2025, there are some big changes on the horizon, especially this coming year. First of all, number one, currently Medicare Part D plans, all of them, have 4 stages of coverage. There's the deductible stage, the initial coverage stage, the coverage gap or the donut hole, and finally the catastrophic coverage. This year in 2024, when you hit the catastrophic coverage stage, your copays for all of your medications drop to zero. There's zero copays for all covered medications. Next year, they are eliminating the coverage gap stage, that 3rd stage. So there will only be 3 stages next year: the deductible, initial coverage, and catastrophic coverage. So that's the first big change that's coming. Second of all, they are also next year putting a firm $2,000 maximum out-of-pocket limit for all covered medications that will apply for all Medicare Part D plans in the marketplace. That means that when you hit this $2,000 in copays in your year to date, then you will cross into the catastrophic coverage stage where you will have no copays for the remainder of the year for those covered meds. And then finally, third, the Part D plans will be required to offer the Medicare Prescription Payment Plan. This is a new program this year or this coming year. And what this does is it's a program that is available to all beneficiaries on all Medicare Part D plans that will allow you to spread out your copay costs for your medications into fixed monthly payments over the course of the remainder of the year. This is a big deal because many people wind up getting hit hard in January or February or March in the first few months that they're on their plan with enormous copays because of deductibles, and the cost of their medications are just so high they have big copays. Now, the fact that they've got a $2,000 limit to your out-of-pocket expenses is a great thing. But what if you hit that limit in the first or second month? You still have to come up with a couple $1,000s in those first couple of months. Well, this way you can spread out the costs over the entire year, where you wind up paying effectively a couple $100s or less per month every single month over the course of the whole year. Should be a big improvement to the affordability of our medications. So most of us will benefit from these improvements to the Part D program. However, as you can imagine, these sweeping changes may also necessitate changes in other areas for these plans. Now, it's important to understand that as of the recording of this video, which is August 8th, 2024, we don't know yet what any of the plan changes will be for 2025. The companies have yet to announce those. However, what we are prepared for is bigger than usual changes in things like premiums and the formularies and the copay structures on these plans. So it's going to be important to pay attention this open enrollment period, this annual enrollment period, to what those changes are. By October 1st, you should be receiving, or earlier, you should be receiving your annual notice of change from your Part D provider, the company that provides your insurance. Pay attention to that. And of course, we will be here to help you do your reviews, just like we have been over the course of the last 15 years. So I wanted to make you aware of these changes, and we'll have more on this as the date approaches, but I wanted to make you aware that there are some big changes coming. I hope this finds you well. Thank you.